Hi, I'm Bonnie Annis, and I'm here representing the Northumberland Central Chamber of Commerce. And today I have with me Jamesi Sutherland from Compassionate
Our home
Heart Home Care Services. Right. So thank you so much for joining us today. And I am really looking forward to learning more about your business. But before we start, I would just like to introduce Jamesi a little bit to say that she's been working in the nursing field as an RN for 14 years, both in education and in some very, very niche areas around Parkinson's and epilepsy and some very, very specialized care, which is kind of awesome considering the direction you went. And back in 2023, you decided it was going to be a good idea
Yes.
to start your own business. Can you
Yeah.
just tell us a little bit about why you wanted to start your own
Yeah.
business?
So I moved to Brighton, from Whitby area to Brighton 2.5 years ago. And when I moved to the community, I was looking for an opportunity to see how I can serve my local community. And so I reached out to a group that was in Prince Edward County that was looking to establish a nurse practitioner-led clinic. And they needed some help with grant proposal, writing a grant
Oh, writing
proposal
grant proposals. That
for
is
the clinic.
such an intense level of work. And so that's where you found that there was a big gap in your
Yes,
community,
yes. And it
right?
was in that research that I realized that there was a gap in Prince Edward County, and that led me now to want to find out what was happening in Northumberland where I live.
Right. And we
And so
know.
that's where my research
And you
started.
mentioned that our community has a higher proportionate of older
Adults,
adults
yeah.
here.
Hmm.
So when you started your business, you mentioned that you started in 2023
Hmm.
and that you joined the Chamber of Commerce very soon thereafter. So, how has, with the broad range of services that you offer, how has the Chamber brought value to you in terms of supporting your business?
Yeah, definitely. The chamber has been very important to us, especially with giving us connection to other local businesses in the area. One of the events that I really appreciate that the chamber holds is the meet and greet. It
Right.
happens on a monthly basis. There's a number of events that happens, but that one I love
Love
especially
that one. That's
because
where I first met you, was
yes,
at Embellish,
yes,
where
yes,
we took a look and the all the things they were making there. It is so wonderful to
yes,
meet the people that live here
yeah.
and you get to know them a little bit. And what other aspects of the chamber are beneficial?
Yeah, so that was one of them because it allowed me to form connection with other local business owners, and it gave me an opportunity to see what their needs are. Because sometimes in conversation, you recognize that they have needs within the community for healthcare services, and then you got to connect with them on that
Yeah.
level.
You
Uh,
can be on Google, you can have a website,
Exactly,
but
but those personal
meeting people for
connections,
sure. And I do
yeah,
think that the chamber does that really well.
yeah,
And our monthly meet and greets are very, very
very, very.
popular. So I would like to talk a little bit about the services that you offer. We know,
Mhm.
given our healthcare climate here in
Yes.
Ontario, the demands are increasing
Mhm.
for home care services. You provide a wide range of home care services. And my question to you is, and I'm sure you can do this well because you nurses are great at multitasking. How do you ensure that your services are personalized for each person, given that you offer so many different
Mhm.
things? And I'm assuming you've had some pretty rapid growth as well.
Yes, and so one of the ways that we ensure that our care is very personalized, we start with the planning of their care plan. So when we meet a client in the community through consultation, we sit down and take time to understand that client's
Mhm.
needs. And not just their needs in this very moment, but we take time to anticipate what could be future needs.
Right.
And then our team is we're able to put together a team that will match that client's needs. So one of the things that we do, our caregivers, we know their skill set, what their area specialties are, and we pair them accordingly with clients to
Okay.
meet their direct needs. So that's one of the
So
things that we do.
somewhat like a dating service for home care.
Yeah, to
Okay.
make sure that the match is right and
That's
that
good.
they're having their needs met. So we take a lot of time in making sure that that pairing happens and it's a very good pairing for the client. And so a lot of work goes into the care plan development. And the other piece too is that our team has a variation of skill sets. So we have both nurses and personal support workers. So
Okay.
their skill set is very vast. So we're able to meet the needs based on the services that we offer.
So one of the things I noticed on your website is that you mentioned that your care, the care you provide, you aim to ensure it's affordable for the family. I don't want to go too much into that because people should definitely contact you to ask questions. But how was that? How did that become a key aspect of the type of work that you do?
Well, I think being a nurse for so many years, I've seen so many situations where clients are coming home and they don't have the care that they need. And when they are reaching out to private companies, they're like, the cost is too much. I cannot afford this. And so that was a big part of my planning. I want to make sure that whatever we were going to have available, that they will be able
That it's
to do
accessible.
that's accessible to them. And so our team is always reevaluating, can we do more?
Oh,
Right. So when a client comes, so another thing that we do, we connect to make sure, do you have your private insurance? Is that something that you can tap into? Also,
great.
the government offers funding for home care.
So you don't only just provide the healthcare piece, you provide the
Resources.
resources to help people.
Yes.
That's amazing.
Yes.
My family, we went through our own journey with dementia, and we didn't know you were there. Actually, I think before you started your
Yes.
business,
Yeah.
but I know many families have needs for
For
additional services, and I think
yes,
that's
they
really
do.
valuable. So speaking of families, I'd like to ask if you could share a story that
Yes.
kind of embraces the heart of what you do, what story would you tell?
So first, I want to say the name itself, Compassionate Heart, is something that really I hold dearly because when naming the company, I wanted to make sure that it reflected my heart and what and how I care for people. And so everyone who came on our team, that was a key value for us, for compassion to be a part of that. So the story I'm going to share with you was a lady that was discharged from hospital. She was given a very poor prognosis going home, and she was told 2 or 3 months might be the timeline. And the family engaged us because they wanted 24/7 care, but they also want nursing to come in and assess her. And so we got involved in her care. We got to know the family, got to know the client, understand her needs. We spoke with the hospital staff to make sure we knew what the care that she needed coming home, what was needed. And when she got home, we started her care. We make sure that the team that we placed with her was the appropriate team with the appropriate skill set going into the home. So when we started care, we realized quickly that there are other services we could connect her to that she could benefit from.
Oh,
So we connected her, for example, with occupational therapy because she was having some issues with the wheelchair that they'd sent home, and also psychiatry. She wanted to have counseling and so forth. So we were tapping into other community resources along with the care that we were providing, and we saw a huge improvement in our overall well-being. And it basically it shows that when you have a holistic approach to care, you can see improvements that you cannot even
that you
imagine.
couldn't even forecast, you couldn't
No,
anticipate.
you
And I
can
imagine
anticipate.
that
Yeah.
at the end of life,
Yes.
you gave that family a gift that they could be with their loved one
Yeah.
and spend the time caring for
And she
her.
recovered really well and still doing well today.
Ah, that's
Still
exciting.
doing well
That's
today. The family
exciting.
came back and they thanked us and they said, Jamesi, you took an anxiety-filled situation, a grim situation. Your team took that grim situation and brought so much light into it. But also, she's back on her feet. She doesn't need our help any longer from personal care services. We're only doing wellness visits from nursing once a month. She's doing so well. It even shocked us as
Oh,
caregivers to see how much improvement.
that's
But
wonderful.
the medical team that came by to see her, because she had palliative care services from the community, they came by and they're like, this has been a huge change. We did not see this
That's
coming.
wonderful.
So,
And what a gift
yeah,
to be able to share that story. And when things feel hopeless, when
yeah,
things feel that there's nothing you can do, and certainly the struggles that we have with
yeah.
the public health
Oh, yes.
resources,
Oh, yeah.
to have someone they can
Mhm.
call on like
Yes.
you and your team, that's got to be such an incredible gift
It's
for
an
the family.
incredible gift for the family. It's an incredible gift for us because it warms our hearts to know that we have made a difference in our community. And that's our goal. That's our team's
I
goal.
am so glad that you're a member of our chamber, that you bring your skills and your services to our community.
Thank you.
And we all hope that we live a good, long, healthy life. But should we have experience an illness in our family, it's really nice to know that we have these resources.
Mhm.
Jamesi, I'm so thrilled that you took the time out of your busy day to come here
Thank you
today,
for having me.
and I wish you all the best in
Thank you.
your future success.
Thank you
Thank
very
you.
much. Thank you for the time today.